Hey, welcome back. So RSV rates, they're going up, right? The season of RSV has arrived earlier this year, and we're going to see a more aggressive case of RSV this time around. Hospitals are filling up with RSV cases. All right, so if you haven't already, hit that like button, little thumbs up, and subscribe to the channel. That way you never miss out on any opportunity for health accumulation for yourself and for your family, for your friends, just that opportunity to share the good news. All right, so respiratory syncytial virus, RSV. This is the most common acute lower respiratory tract infection in children. And lower respiratory tract is like the lung tissue versus like this area here. So kids under 5 years age, a really good chance at some point they've already come in contact with RSV, or they will. And RSV is serious. It can definitely be life-threatening. So we want to take it seriously. We don't want to be flippant about it. But thankfully, like most all virus and infectious entities, hospitalization, the life-threatening potential of this virus are closely tied to the host, to us humans. Whether or not that virus is replicate out of control, causes big inflammatory response or not. So I have 6 children, 3 of which are under 5 years of age. Now, I could live in fear and worry and torment related to RSV, and I could spread that to my children. Or I can proactively support measures that decrease their risk of RSV manifesting in a way that would lead to them being hospitalized, in an emergency situation, and finding that, there's nothing I can do. I just gotta give them over to this technology. So this starts when our babies are in the womb. The American Journal of Respiratory and Critical Care Medicine did a study that showed, this doesn't sound wild, but that pregnant mothers who consumed a high sugar and a high refined carbohydrate diet. So when I say those high sugars, high carb diet, high refined carbohydrate diet, we're talking about white bread, we're talking about pasta, crackers, chips, donuts, candy, Gatorade, soda pop, milk chocolate, added sugar to all your dairy products. That these babies then, whose mothers consume this stuff, were much more likely to have severe outcomes related to RSV infections. Is that crazy? It is amazing how our food affects not only us personally, but it affects the generation that comes after us. Their capacity to manage life optimally and to have decreased likelihood of emergency situations when infections arrive. So once your child has been born into the world, children who are overfed, basically where they're getting caloric dense food that is nutritionally devoid. So now we're thinking like rice cereals generally, crackers, Cocoa Puffs, chips, candy, muffins, ho-hos, Swiss rolls, all that other white and tan packaged food. The type of food that's got that fancy cartoon label on it, all shiny, saying that they're just for kids. Unfortunately, these just for kid foods are making it more likely that your child's going to require oxygen therapy. They're going to require oxygen therapy for a longer time, that they're more likely to be in the hospital, that they're more likely to spend more time in the hospital. These children are also having elevated levels of an inflammatory marker called interleukin-4, IL-4, all of which is setting them up for a disaster related to an infection. In this case, we're talking about RSV. So food matters. How can you get more meat, more fruit, more vegetables, even more dairy products, goat products that don't have added sugars put into them? How can you get more of those into your child's routine and push out, the Capri Suns, the Gatorades, the Powerades, the mini soda pops, the juice boxes, the snack packs, all this ultra convenient food literally is setting your child up for a potential disaster, and it can be avoided. RSV doesn't have to be a worry, a fear, if we've been filling our children up with wholesome nutritionally dense foods. So sure, it will take some time, to recalibrate their taste buds, to recalibrate your life pattern. And, you're gonna have to prepare ahead of time. That word preparation, it's gonna come into play here. But I'm telling you, who wants to be feeling helpless, with machines plugged into our children that, oxygen and, all these medications and steroids that they're having to do, when potentially literally us just doing these day-to-day things could set them up for massive success and massive capacity to clear RSV and to mitigate the inflammatory response created by a virus. We can do that ahead of time. Okay, so in addition to the dietary benefits, which I've harped on here, in mitigating RSV infection intensity, vitamin D, D as in dog, sufficiency has been shown to decrease the inflammatory response to viral infections generally, but also RSV. And basically decrease that inflammatory response in the airways without jeopardizing the body's ability to clear the virus. So this is a big deal because we need our natural inflammatory response to kick up, to shut down viral replication and to clear the virus out. So we don't want to do things that are really suppressive, that especially done at the wrong time, suppressive things can lead to the virus just hanging around for a long time. That's things like Tylenol, ibuprofen, have been shown to slow down viral clearance. So adequate vitamin D, which is, a standard deficiency in the Western world, can reduce the severity of RSV. So I give my kiddos, vitamin D drops at least 5 out of 7 days a week, no doubt. Sometimes I forget it, but 5 out of 7 days a week, they get those little drops of vitamin D just to make sure that their levels are staying sufficient. So another potential preventative measure is actually the use of probiotics. So there was, in scientific reports published in 2019, a study showing that lactobacillus probiotic strains could actually decrease the RSV-induced inflammatory load and mitigate actually the risk of RSV as a whole when you were using these lactobacillus strains prophylactically, so before the onset of the virus. Now you may be saying, my child has RSV right now, what can I do? Great question, because I know this is what made me want to put this video out, because there's so many people telling me that their kids have RSV right now. And one of the challenges of RSV is all the extra congestion and just that mucus production that's just over the top, which makes it hard for the kid to breathe, to sleep, coughing a lot, which makes them even harder to sleep. And especially for the very young children whose brain is set on nasal breathing, which is a blessing. We want them nasal breathing all the time, right? But when the nasal passages are clogged with snot, it's tough to do that. So I often use something called the NoseFrida. Find it on Amazon, and I literally used it on every single one of our children, probably multiple times on most of my children, to pull out those slugs of mucus from their nasal passages so they can breathe. And this baby works wonders. Sure, they're going to fuss, they're going to cry, they're going to hate it, they're going to sit there and be like going everywhere, for that 10 to 15 seconds where I'm trying to suck it out. But literally, once you suck it out, pick them up, hug them, kiss them, hold them, and almost instantly they're chill out because they can breathe their nose again, and they're now 5 minutes later they're willing to go to sleep. So you can also put in saline drops inside their nasal passages. I can help loosen up the mucus as well, but really the NoseFrida is the thing I've found to be most effective in my family and for my kiddos. So if your children are over 1 year of age, allowing them or giving them a small spoonful of, either like some raw local honey or manuka honey, multiple times throughout the day can also help with decreased inflammation in the respiratory passages there. Great antimicrobial effects, antiviral effects of manuka honey, and just tonifying effects for the immune system. And if they have a fever, that just keeps coming, then you've got to consider the wet sock treatment. The wet sock treatment is money, and it costs you no money. I'll put a link to the wet sock treatment, but I've done this on myself, my siblings, all my children, even when they're little, to help bring their fevers down, because no parent wants to give their children a drug like Tylenol, to bring the fevers down. We know all the negative effects of Tylenol and how it suppresses glutathione production and increases the risk of a lot of developmental cognitive issues later on. So we don't want to give our kids Tylenol, but we want to bring their fevers down because we want to support their comfort. Because a child who has a raging fever, it's harder to feed them, it's harder to get them to drink stuff, to take even supplemental nutritional support. So if we can get the fever down, it's much more likely that we can get what we want to get into them to help them make it through RSV and move on with life. And I will also often open capsules of N-acetylcysteine, NAC, mix it in applesauce, mix it in the honey, mix it in a little bit of kefir, or even like just a little smoothie. And after I blended everything, and I'll give that to them to help basically break up mucus secretions, act as an antioxidant to help the lung tissue and get those glutathione levels back up in the lung tissue. And then of course elderberry. Who doesn't love elderberry? Elderberry, those berries, all those polyphenols loaded with antioxidants to support the inflammatory cascade and decrease inflammation, as well as being it's an antiviral itself. So getting the elderberry going right out of the gate is something I do in my family. And remember, with all these videos, I am a doctor, a practicing physician, but I'm on YouTube right now, so I'm not your doctor when I'm doing these videos. All right, I hope this has been helpful and it feels like it empowers you to make more awesome decisions related to your kid's food routine, so that you don't find yourself really behind when it comes to an RSV infection and thinking, man, I wish I would have just kind of dialed it in more when it came to food and nutrition for my child. All right, talk to you guys later.